So I think there's been a lot of interest in trying to determine how long we need to give trastuzumab for. Really the original pivotal trial selected 12 months of therapy, but it was not determined by any rational data. It was just picked as a year. They looked at trials looking at 2 years, so the HERA trial compared 2 years to 1 year and showed no additional benefit of continuing trastuzumab beyond a year. So now we've seen a series of trials that have looked at the opposite question: can we shorten the duration of trastuzumab? And so Persephone tried to see, can we give 6 months instead of 12 months of therapy? And while I think it's intriguing that it may be similar in terms of outcomes, that shorter duration trastuzumab may do just as well as longer duration, I think the problem was this was done in a very different era. It was done at a time where a lot of patients were getting sequential therapy, whereas now we know concurrent treatment with chemotherapy yields better outcomes. It was done in an era, with different chemotherapy backbones, and so I think it's hard to interpret that data. I think now we take high-risk patients and we usually give them pertuzumab and trastuzumab. In the low-risk stage 1 patients, we tend to give abbreviated chemotherapy, so paclitaxel and trastuzumab. We don't know in the low-risk patient, could you give them less trastuzumab? Could you give TH with 6 months of H? And I think that's a question everyone would love to know, because it seems like less therapy is probably okay for a lower risk patient, but we need to prove it in a current era with concurrent chemotherapy. And I think that's where I find it hard to interpret these data, because our practice has changed so much since then.